Thank you so much for joining me in this exercise class. I hope you're excited. I hope you're ready to get motivated, encouraged, and learn some more about exercise and how it relates to health and more specifically about cancer. I have behind me a lot of props. I got pretty excited to do this video with you. And I have things that I collected from the house. I actually have, well, first we'll start here. I have this pull-up bar, which you can get. It's usually pretty inexpensive. I think this one might have been like $20 or so. You can just hang it up in the doorway, do some pull-ups. You can even put it on the ground and do some push-ups. Then I have this snowboard. It's a pretty, like, you know, not fancy one that you could just put on and go down the backyard hill with it, which is exactly where it came from. And honestly, I don't know if this is mine or my neighbor's. The kids some kids came over last time it snowed. Then I have this lovely pantsuit that you could wear going skiing or snowboarding. Then I have this helmet, which you can't see, but I'll try to get it for you. This is a helmet for skiing and snowboarding. Then inside here, I have a sweater that my mom got me for gymnastics. She happened to be at Yale for my sister had to take an SAT test there, so she got me the sweatshirt. Then we have a hat for football. I think it's football, Buffalo Sabres. We have a cone for, you know, setting up games around the neighborhood or doing whatever. We have an ankle / wrist weight that you can put on and you could do movements or you could even walk around. Then we have this paddle. This is for a kayak. You know, it has the paddles on both ends. Whoops, which I just broke. It's not really broken, but it just came apart. So you can paddle on your own. Then we have a paddle for one person on a 2-person boat. There were 2 paddles that came with the boat. Oh, we have so many balls. Wiffle ball, soccer ball, volleyball, baseball. I don't have a softball for you. We have a football. We have a spongier football. We have a tennis racket. We have more cones for drills for soccer. We have a bungee or a stretchy thing, which a neighbor friend of mine gave to me as a Christmas present, and I started using it because I was doing a kickboxing video and needed some more resistance, and this actually worked for it, which was pretty cool. Unexpected, but nice. Then I have a weight, a 5-pound weight here. We have a 10-pound weight back here, which you can't really see, and I'm afraid to move it because I don't want things to fall down. We have a wiffle ball bat back here to go with the wiffle ball, and we have a waterproof camera for if you're swimming and you want to take pictures. We have this. This is similar to the chin-up bar, which is just basically a handle that you can put on the ground and do push-ups on that, or dips if you'd like. Then we have a 2.5 pound weight. This is really old school iron. And we have a 10-pound weight back here. Avalanche. We have this 10-pound weight to put on a barbell. So we actually have a barbell at my house, but I did not go so far as to bring the barbell or other dumbbells or other weights. We had 25-pound weights, plates, and all that jazz. But and then we have this cute little baseball bat, which, oh man, I forgot something, which is actually for my nephews. And I played baseball too when I was little, but I chose to bring the one for my nephews, actually for content, which I'll share with you later. And one thing I forgot, I encouraged you to come wearing your favorite workout outfit. So I brought an old workout shirt. This is actually my first lift shirt from my freshman year of college at Boston University. I was on the swim and dive team. I was a diver. And on the back, it says, "Good is the enemy of great." So they would always pick a cool phrase for each year of the season. And I brought also a sweater. I was going to look for an old uniform for my team, and I realized that I had just gotten rid of them probably a couple months earlier because I was trying to clean out and make space for other things. But I still have this sweatshirt, which has my name on it, and on the back it says Terriers Swimming and Diving. I don't know which year that's from. Oh, and then also we have, yeah, gosh, so many things. These are for kickboxing. These are actually gel wraps. The actual kickboxing gloves that I used to use look like this. And somehow I only managed to get one glove, but usually you box with two or kickbox with two. And so the blue and black glove goes over pink glove. So then your hands are nice and protected from the bag and bruising your knuckles. So that's what it looks like. Pretty easy, fancy. Oh yes. So also we have leotards of mine from when I was much younger. This looks like a competition leotard with the long sleeves, but that wasn't actually one of my competition leotards. And it was too hot to wear with the long sleeves, so I hardly ever wore that. This was the first leotard. Actually, I remember I made my first kip. Sorry. A kip is a certain move on bars, and I loved that leotard. It was one of my favorites. Then we have a bathing suit. You could go swimming. We have a paintball helmet. Oh, which you can't see. Here it is. This is my brother's. And then we have some bands. You can put this really firm, it's pretty firm, stretchy band. You can put this over if you have a lifting rack to help you with doing pull-ups or chin-ups to make them easier. You put your knee in it or your foot, you stand on it, and then it helps propel you up so you feel lighter. We have these bands, which I got when I was in gymnastics to help with, I forget what I used it for. I don't remember, but you could use these for all sorts of things. Then I have, sorry, this is taking a while. I have this, which is a roll of belts from when my brother and I did Taekwondo. Taekwondo is another sport, another form of exercise. And then we have a gym bag. Oh, I'm gonna need to move my camera for you. We have a gym bag and a set of gymnastic mats, which are also mine from when I did gymnastics. So now that we see some of the potential sports that can be played or participated in for exercise, let's talk about actual exercise. And one of the reasons I'm doing this video is because I am passionate about cancer prevention. There's so much suffering from cancer. So many people die and loved ones are lost. People have to live without their loved ones, or they go through suffering with their loved ones. And a lot of it is preventable, and exercise and physical activity is part of that. So I wanted to research it a bit more. I know I knew in general exercise is important, but in doing some research, I found that, there's more to it than I realized. There's some surprising things. And I struggle with exercising myself. So I you know, as you can see, I participated in several different sports. When I was younger, I played soccer, baseball, taekwondo. I danced for a little bit. Then I did gymnastics and springboard diving. And I did okay with them. It was easier for me because I was part of a team, so I wasn't on my own trying to do things. But then as an adult, after graduating college and not having a team to work with, then I started kickboxing, which I really liked. Excuse me one second. I got some green tea here. So then I was doing kickboxing, but then series of events happened. Their hot water boiler broke, so I couldn't exercise on my way to work. Then financially it was getting too expensive, and then they were moving away farther. And then I knew I didn't want to stay at my job, and the gym was like 25 minutes from home. That's almost an hour of driving just to go to the gym. So it's too much for me. So then I went to another gym, signed up for another gym, and I was like, okay, like, you know, it's not exactly what I wanted, but I'm getting used to it and I appreciate it. Then that gym closed. Then I signed up for another gym, and I did not, I enjoyed the class, and I was hopeful that I could go with friends, and my friends, you know, weren't able to go, and then I wasn't able to go at the time that, you know, we had set up. So then I was like, okay, I'm just going to work out from home on my own. And I had an idea to offer a class to anyone who wanted to exercise with me. I'm not teaching the class, but it is more just for me and others to get together, to encourage each other, motivate each other, hold each other accountable, to make sure that we actually get exercise done, because I have not been doing a good job of that. And so I would like to invite all of you. Previously, I just had it open for women, but men and women, if you want to join me, I was doing it once a week for Friday mornings at 7:15. I may or may not change the time, but now, because of what I have read, which I'm going to share with you, I am going to open it up to 3 days a week, Monday, Wednesday, and Friday mornings. So if you're interested, please send me an email, contact@bayleyobrien.com, and we could work out together. And so the way that it works is I'll set up my computer and we'll do a Zoom call, and I will share a video with you and we'll follow along together. So I have this gymnastics mat that I just showed you, which is what I use. I, you know, lay it out in my living room and I set up the video. I'll share the video with you and we'll get started. And we can exercise together. So if you wanted to join me on that, you could send me videos that you would like to do for exercise. I would prefer about 30 minutes or so. And that actually is probably a good way to get started into some of the research that I found. And it's the US Department of Health and Human Services, which has guidelines for exercise for Americans. And they have guidelines for children, adults, and older adults, and pregnant women. So for children, they recommend, if you have children, they recommend 60 or more minutes each day for children to exercise. And that should be at least moderate aerobic activity. And at least 3 days per week should include vigorous intensity exercise, at least 3 days per week muscle strengthening activities, and at least 3 days per week bone strengthening activities. And these can include things like playing on the jungle gym or playground. And it can also include things like jumping jacks, which you might not, may or may not have thought of, and other sports. For adults, the general recommendation for the absolute healthiest lifestyle and preventing chronic diseases is to do at least 150 minutes, which is 2.5 hours, of moderate intensity aerobic activity. And this can include vigorous walking. It doesn't have to be running. It doesn't have to be playing volleyball. It can just be brisk walking. And then you can swap that with higher intensity exercise for fewer minutes per day, averaging, I believe, about 22 minutes per day of vigorous intensity aerobic activity each week. Okay. Then for adults who are 65 and older, they recommend that if you can't do 150 minutes, which is 2.5 hours a week of moderate aerobic activity, then be as active as you can be. Everybody is in different situations, different states of physical health. Some people are healthier than others, but just start with where you are and slowly work your way to longer, more intense activity. For women who are pregnant, they say that if you haven't been active physically, to slowly work your way up and consult with your doctor. After the first 3 months of pregnancy, you should not do any, excuse me, any kind of activity on your back. And then, excuse me, sorry. If you are already active, then you can usually continue with your activity as long as you talk to your doctor and you communicate with them throughout the pregnancy. So these are general recommendations for what is appropriate. And activities, like I said before, they can be sports, they can actually be gardening, intense gardening, or intense chores and housework. Physical activity doesn't necessarily mean sports. Okay. So what happens if we get too little exercise? As you know, I'm passionate about cancer. That's why I'm doing this. Exercise plays a role in preventing cancer, but it also plays a role in preventing other chronic illnesses. And there is a study, a very long one, and I usually try to print out studies, but it was over 150 pages, so I just printed a few. It's called Lack of Exercise is a Major Cause of Chronic Diseases. This was done in 2012. This is from the National Institute of Health. And they found that too little exercise, quote unquote, is a primary cause of most chronic diseases. So these include, but are not limited to, I didn't even write them all out, premature aging and death, obesity, insulin resistance, hypertension, PCOS, which is polycystic ovarian syndrome, coronary heart disease, non-alcoholic fatty liver disease, stroke, bone fracture and falls, osteoporosis, type 2 diabetes, rheumatoid arthritis, constipation, pain, diverticulitis, and then of course cancer, including colon, breast, and endometrial cancer. I'm sure that there are other, man, it's dry in here. I'm sure that there are other types of cancer that inactivity is related to, but that was just from this one study. And so there are some interesting things that I found in this book called Breast, the Owner's Manual. Dr. Christy Funk, as if you saw the last email or video that I just did about cancer prevention as an overall topic, she found, or in studies that she quoted, which I can send to you if you'd like, there was a very interesting study which showed that women who went through breast cancer treatment, if they had been physically active prior to treatment and after treatment they discontinued their physical activity, they were at a 300% increased risk of death after diagnosis. So stopping exercising after breast cancer is a bad idea. And there can be limitations. Cancer is, it can be debilitating, not just physically, but also mentally. So whether you have physical restrictions or mental blocks, depression, maybe anxiety, you're worried about your future and whether you're going to get another cancer diagnosis, these can all unfortunately prevent some people from exercising. But what I want to encourage you and everyone to do is not to give up. There is, well, there's a lot of hope, and there are a lot of things that we could go over, and I don't know, everybody has a different setback, but it reminds me of this one little kid who had cancer, and he was going through chemotherapy treatments, and he actually continued to lift weights through his chemo treatments, and there was a viral story on him online. I'll have to find that and share that with you. But they're really there there aren't very many legitimate reasons not to exercise. Even if you do have a physical limitation or a mental limitation, there are ways to work around it. Like if you have lymphedema, there are certain exercises that you can find on the internet to work around lymphedema, or hopefully you could find a personal trainer to work with, or just research it, figure it out on your own, and do your own exercises, maybe from a book. There is a woman, Carol Michaels. Okay, carolmichaelsfitness.com. She specializes in cancer recovery fitness, and she has some great videos that you can buy. You can order them, I'm pretty sure, through her website. She has DVDs and books. She's a great resource if that's an issue for you. That's one thing about too little exercise. But overall, if you're not exercising enough, your risk of cancer goes up, especially if you've already had cancer. So that's if you have too little exercise. What about too much? Is there such thing as too much exercise? Actually, there is. There is a study done on marathon runners also, which was in Chris's book, Chris Beat Cancer. Marathon runners are 6 times more likely to get sick after a marathon than they would be if they hadn't run a marathon, because severe, I would call that maybe severe exercise, extra strenuous, extra long exercise, so actually can suppress your immune system, use up your antioxidants, and damage your muscles. It can cause your muscles to shrink, actually, because they're breaking down. So marathon runners are more likely to get sick after running marathons due to immune suppression. What is just right for exercise? Exercise improves cardiovascular health, insulin resistance, depression, anxiety, female and male reproductive disorders, all the things that you heard me talk about before. Another benefit, this is the prostate cancer study that I was thinking of before from Chris's book. In 2004, men with early stage prostate cancer who exercise at least 20 minutes per day of either walking or bicycling, they had a 39% reduced risk of dying from cancer and a 30% risk of dying from any other disease compared to men who did not exercise at all. That's huge. Decreasing your risk of more than a third of dying from prostate cancer is a big deal, and it's easy. It's just 20 minutes a day of walking or riding your bicycle. And so I'm sure that applies to cancers other than prostate cancer. So we know about the benefits of exercising the right amount. How about, what are the actual guidelines? I talked about this before. All you need to do as an adult is 30 minutes per day of moderate intensity aerobic exercise. Adding in weight-bearing exercise or resistance training helps to build your bones as well, prevents osteoporosis, and get your kids active as well. If you have kids, they need to, not just adults, middle age and older adults are at risk for cancer. Children are unfortunately at risk for cancer in our day and age as well. And children who watch too much TV or have too much screen time tend to have less physical activity. So limiting screen time can help with getting your kids motivated and encouraged to exercise. And it can even be a family activity. You could all go ride your bikes together. You could go for a walk or a jog together. moms jogging with their babies in the stroller. That's something you can do. Of course, it would be harder during the winter months because it's colder, but it can be done. And speaking of kids, um, this, when we want to approach exercise, we need to be motivated to do it, right? So think about what is your why? Besides not getting cancer, wanting to live, like what is it that you want to live for? What is it that you want to feel good for? Exercising makes you feel better. It can help with depression, anxiety, helping you to sleep better. But what are the things in life that you enjoy? Are you looking forward to, do you have kids or do you have grandkids that you want to keep up with and play with? Play t-ball with them? Do you want to play soccer with them, or do you just want to chase them around the house? Kids take a lot of energy out. And if you don't have kids, maybe you're like me, I don't have kids, and I just, I want to prevent cancer in my own life. I know that I've not been quite as healthy in my late 20s as I was in my early 20s. I want to feel better. I can physically feel it when I don't exercise. I have more energy, I have more focus and clarity. I'm able to work faster when I exercise more. And I, just feel better about myself in general when I exercise more. And so maybe those are some things that are motivating to you. Maybe that's why you're watching this video. So, as a takeaway, what is one thing that you can do to exercise better this week, to treat your body better, to reduce your risk of cancer and other diseases, and why? So, think about those two things, and I'll be doing it with you. Let me know if you want to exercise with me Monday, Wednesday, Friday mornings, and hopefully I'll see you soon. Hopefully I hear about how your exercise is going and how things are getting better for you and how you feel more confident to prevent cancer and live your best life. Well, thank you so much for joining me, and I'll talk to you soon.